Hello, good morning.
Good morning, doctor.
Well, my name is Dr. Faraz and I am one of the treating physician at this clinic for today. So before we proceed further, can I check your name if you don't mind, please?
Yeah, sure, doctor. My name is Rebecca.
Well, Miss Rebecca, thank you very much for visiting me. So how can I help you today?
Yes, doctor. I am here for my 8-year-old son, and I think he is growing a lot faster than his classmates. I am really worried because his older brother had not reached that height by the same age, and I think he must have a growth disorder because I have get him checked by some other doctor, and he confirms that my son's weight, height, and measurements are in the 19th percentile, which is at the highest end of the normal of his age. So I am very worried about the tall height of my elder son.
Well, Mrs. Rebecca, I can understand your concerns. Let me assure you that being in the 90 percentile range is not necessarily a problem. This is basically an upper normal limit of the growth. So, to get the better understanding about your son's condition, can I ask a question if you don't mind?
Yes, doctor, you can ask.
Can you please tell me that how tall the parents of the boys were when they were the child?
Doctor, me and my spouse were both of the average height as a children. We don't have such problem that my younger child has.
Well, thank you very much, Mrs. Rebecca, for providing me this information. So, as you have told me that the parents of the child were within the normal range of the growth. So, here I would like to discuss a term which we in medical terminology which we called as precocious puberty. Do you know anything about this?
No, doctor, what is this precocious puberty?
Well, thank you very much. Let me clarify you. Basically, this is a problem with the growth hormone. In this, a high level of growth hormones are produced within the body. So these high levels of this hormone can lead to the abnormal gain in the height, weight, and other measurement of the growth. Am I clear so far, Mrs. Rebecca?
Yes, doctor. So, as far as I can understand, that my child is suffering from precocious puberty, and this is simply a growth spurt. This is what you have told me.
Yes, I have told you this.
Okay, thank you so much, doctor.
You're welcome. So, Mrs. Rebecca, I want to send you a specialist doctor to further proceed and further for further workup of the condition of your child.
But doctor, as you have told me that my son is suffering from precocious puberty, then why are you suggesting me to consult a specialist?
Well, Mrs. Rebecca, I can understand your concern. If I were you, I would have the same concerns in my mind. Actually, I have told you that I am a general physician, so I would like to refer you to a specialist doctor, which we called in medical terminology as pediatric endocrinologist. Are you getting me?
Yes, doctor, I got your point, but I think as you have told me that if my son is within the normal limits, then why shouldn't I wait and see if his growth spurt slows down before following up further?
Well, Mrs. Rebecca, I can see that how difficult it is for you to talk about the problem of your child. So let me explain you that your child may develop a condition in medical terminology which we call as gigantism. In this condition, basically excess growth hormones are produced in the body, which we also called. I previously told you that it may be a reason of precocious puberty, but in child there is a problem in the mind, in the brain of the child, in which a gland which we call as pituitary gland, a tumor or adenoma of that gland may develop. So the purpose of the referral is that the child endocrinologist will evaluate if there is any pituitary adenoma or tumor of any pituitary gland, that it will definitely lead to surgery, because surgical removal of that tumor is the final treatment. Are you getting me, Mr. Rebecca, so far?
Yes, doctor, I got your point. Thank you so much. And now I am agree to see a specialist.
Well, thank you very much. I am really pleased that I have addressed your concern in a proper way. Is there anything else, Mrs. Rebecca, that is bothering you?
No, doctor, thank you so much. You have already addressed my concerns in a proper way.
Thank you, Mrs. Rebecca. I wish a speedy recovery and healthy life to your child. Thank you very much for visiting me.
Thank you, doctor.